Anatomy and Physiology, Bones and Movements, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, Bones and Movements, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of the human skeletal system. Part 1. 1. What are osteogenic cells? Osteogenic cells are bone stem cells. 2. What are bordering cells? Bordering cells are cells on the surface of the bones. 3. What maintains the normal blood calcium concentration? The continuous deposition and resorption of bone matter. 4. What is the cause of rickets? Rickets are caused by deficiency of minerals in the bones. 5. What is the cause of achondroplasia? Achondroplasia is due to the defect of the endochondral bone and the growth of the cartilage. 6. What is osteogenesis imperfecta? Osteogenesis imperfecta is a genetic disease due to collagen deficiency, and the person is at risk for frequent bone fractures. 7. What is another name for the frontal plane? Another name for the frontal plane is coronal. 8. What is another name for the cross-sectional plane? Another name for the cross-sectional plane is axial. 9. The upper part of the body is also called the cranial. 10. The lower part of the body is also called the caudal. 11. What is an agonist muscle? An agonist muscle is a muscle that allows movement in the same direction. 12. What is an antagonist muscle? An antagonist muscle is a muscle that opposes movement. 13. Name the main movements of joints. Flexion to bend or to shorten the limb. Extension extends the limb. Abduction, movement that moves the body away from the median. Adduction, movement that approaches the body to the median. Lateral rotation and external rotation movement. Circumduction, movement with 3 degrees of flexibility. Part 2. 1. On which plane does the flexion-extension movement take place? On the sagittal plane. 2. On which axis does the flexion-extension movement take place? On the frontal transversal axis. 3. On which plane does the abduction-adduction movement take place? On the frontal plane. 4. On which axis is the abduction-adduction movement? On the sagittal transversal axis. 5. What is a coronal cut? A coronal cut is the frontal cut of the brain or head. 6. What is a hypertension movement? A hypertension movement is a movement beyond the normal flexibility. 7. For the knee, the movement of extension is towards which direction? Interior or exterior? The exterior. 8. For the knee, the movement of flexion is towards which direction? Interior or exterior? The interior. 9. Why are the hand and foot stable? The hand and foot are stable due to the deep transverse metatarsal ligaments that bind them together. 10. What is a contusion? A contusion is a lesion without fissure often caused from the outside by a mechanical force. 11. What is a dislocation? A dislocation is the displacement of the bones from their joint. 12. What is a sprain? A sprain is a stretch of the ligaments without being torn off. 13. What are synovial joints? Synovial joints are mobile joints. 14. Give an example of a fibrous joint. The sutures of the skull. Part 3. 1. The axial skeleton has how many bones? The axial skeleton has 80 bones. 2. The skull neurocranium has how many bones? The neurocranium has 8 bones. 3. The face has how many bones? The face has 14 bones. 4. The skull in its complete form has how many bones? The skull in its complete form has 22 bones. 5. What is the rachis? The rachis is the spine. 6. The spine has how many bones? The spine has 26 bones. 7. Name the segments of the spine. 7 cervical vertebrae, 12 thoracic vertebrae, dorsal, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 coccyx vertebrae. 8. Which bone does not articulate with the other bones? The hyoid bone. 9. The appendicular skeleton has how many bones? The appendicular skeleton has 126 bones. 10. The tarsus has how many bones? The tarsus has 7 bones. 11. The metatarsus has how many bones? The metatarsus has 5 bones. 12. The phalanges have how many bones? The phalanges have 14 bones. Part 4. 1. Name the 3 types of joints. Synovial joints, cartilage joints, and fibrous joints. 2. Give an example of a cartilaginous joint. The vertebral discs. 3. Which is the first finger? The thumb. 4. What are floating ribs? Floating ribs are ribs that are not attached to the sternum. 5. What are false ribs? False ribs are ribs attached to the sternum through costal cartilage. 6. What are true ribs? True ribs are ribs that are attached directly to the sternum. 7. What are the classifications of joints? The classifications of joints are by their structures, synovial, cartilaginous, fibrous, joint activity or not, and their functions if they are mobile, semi-mobile and immobile. 8. Do joints really mean mobility? No, joints do not really mean mobility. 9. What is a joint? A joint is where bones meet. 10. What goes through the intervertebral foramen? The nerves. 11. What is the function of the axis? The axis allows rotation. 12. What is the function of the atlas? The atlas serves to support the weight of the head. 13. What is the smallest bone in the human body? The stapes. Part 5. 1. What does the shape of the bone of the skull, the sphenoid, look like? A butterfly. 2. Where is the hypophysis? The hypophysis is found in the sphenoid. 3. What is the function of the hypophysis? The hypophysis secretes growth hormones. 4. What is the only articulated bone in the skull? The mandible. 5. What is the function of the styloid process? The insertion of the ligaments. 6. What is the bone that makes us smile? The zygomatic bone. 7. What is the function of the ethmoid bone? The ethmoid bone helps to warm the air in the nose. 8. What is osteology? Osteology is the study of the bone skeletal system. 9. Skeletons are large reservoirs of. Skeletons are large reservoirs of minerals. 10. What are the 4 types of bones? Long, short, flat, and irregular bones. 11. What is arthrology? Arthrology is the study of joints. 12. Name the ribs. There are 24 ribs that include 7 pairs of true ribs, 3 pairs of false ribs and 2 pairs of floating ribs. 13. Name a very active area for bone reconstruction. The periosteum. Part 6. 1. The increase of the bone in thickness is done by the periosteum. 2. What allows growth in the length of the bone? The connecting cartilage. 3. What is scoliosis? Scoliosis is a deviation, a malformation of the spine. 4. What allows healing of a fractured bone? The periosteum. 5. What liquid is found in certain articulations? The synovia. 6. What vertebra allows the rotation of the head up and down? The atlas. 7. What is the largest bone in the face? The mandible. 8. What is the protein content of the bone? Ossein. 9. What are sutures? Sutures are the motionless joints that connect the bones of the skull together. 10. Which of these joints is more stable? The joint of the shoulder or the hip joint? The hip joint. 11. In relation to the answer to question 10, why? The hip joint is more stable than the shoulder joint, because the hip pocket is deeper than the shoulder pocket. 12. What is the largest and most complex joint of the body? The knee joint. Part 7. 1. The upper limb includes how many bones? The upper limb includes 32 bones. 2. How many bones does the carp contain? The carp contains 8 bones. 3. How many metacarpal bones are there? There are 5 metacarpal bones. 4. How many articulations does the upper limb have? The upper limb has about 30 articulations. 5. The lower limb has how many bones? The lower limb has 31 bones. 6. How many articulations does the lower limb have? The lower limb has about 30 articulations. 7. What is the utility of the curvature of the spine? The curvature of the spine allows to absorb shocks. 8. Name 3 deformities of the spine. Hyperlordosis lumbar, hyperkyphosis and scoliosis. 9. What is the best plane to see the movements of rotation? On the transverse plane. 10. How many points of support does the foot have? The foot has 3 points of support. 11. What do you call the ribs that are connected indirectly to the sternum? False ribs. 12. Which vertebrae are attached to the ribs? The dorsal vertebrae. Part 8. 1. What are the bones of the forearm? The radius and the ulna. 2. What part of the body is the metacarpus? The palm. 3. What are the elements of the rib cage? The dorsal vertebrae, the sternum and the ribs. 4. What are the metacarpal counterparts? The metatarsals. 5. What does the red marrow of the bones produce? The red blood cells. 6. Where is the articular cartilage in the long bones? The articular cartilage in the long bones is at the extremity of the epiphysis. 7. What is the function of the connective cartilage? The connective cartilage allows the growth in length of the bone. 8. What is the function of the metaphysis? The metaphysis allows the elongation of the bones. 9. The vertebra that allows turning the head from left to right is the axis. 10. What type of joint unites the vertebrae? The semi-mobile joints. 11. What is the name of the first vertebrae that supports the head? The atlas. 12. What is amphithrosis? Amphithrosis is a joint that restricts or limit movements. Part 9. 1. What are the bones of the spine in the pelvis? The sacrum. 2. What does the spongy bone contain? The red bone marrow. 3. What is the tissue that covers the diaphysis of a long bone? The periosteum. 4. What is the bone that forms the foot? The metatarsal. 5. What is the immobile part that connects a limb to the trunk? The belt. 6. What is the bone that forms the elbow? The ulna. 7. What is the bone that connects the upper limb to the trunk? The shoulder belt. 8. What bone forms the back and side of the skull? The temporal bone. 9. What is the part of the bone that allows the insertion of a muscle? The apophysis. 10. What are the cells in the bone cavities? The osteoblasts. 11. What is the bone that forms the epiphysis of a long bone? The spongy bone. 12. Which bone connects the lower limb to the trunk? The pelvic belt. Part 10. 1. What is the tissue that covers the epiphysis of a long bone? The cartilage. 2. What is the diaphysis of a long bone called? The diaphysis of a long bone is the compact bone. 3. What does the medullary canal contain? The medullary canal contains the yellow marrow. 4. What is the cavity of the central part of a long bone? The medullary canal. 5. What is called the conjugation cartilage? The conjugation cartilage is called the metaphysis. 6. What is the type of joint at the lumbar level? A semi-mobile joint. 7. What is called a motionless articulation? Synarthrosis. 8. What is the type of joint between the cranial and facial bones? The motionless joint. 9. What is the function of the joint capsule? The joint capsule consists of ligaments that keep the joint moving. 10. What type of articulation is the wrist joint? Diarthrosis. Part 11. 1. The skeleton represents how many % of the body weight? The skeleton represents about 20% of the body weight. 2. What is the function of the axial skeleton? The axial skeleton protects the head and the internal organs. 3. What is the function of the appendicular skeleton? The appendicular skeleton permits to maneuver objects and communicate with the environment. 4. How many bones does the head contain? The head has 22 bones. 5. What is the link between the mobility and the stability of a joint or an articulation? Normally, the more an articulation is unstable, the more mobile it is. 6. What is arthritis? Arthritis is the inflammation of the joints. 7. What is dorsiflexion? Dorsiflexion is a decrease in the angle of the ankle joint. 8. What is plantar flexion? Plantar flexion is an increase in the angle of the ankle joint. 9. What is elevation? Elevation is the movement of the body towards a higher direction. 10. What is depression? Depression is the movement of the body towards an inferior direction. 11. Why are the lumbar vertebrae the largest? The lumbar vertebrae are the largest because they support the weight of the upper body part. 12. Why are the cervical vertebrae small? The cervical vertebrae are small because they support only a small part of the body, the head. Part 12. 1. Which is the largest tarsal bone? The calcaneal bone. 2. What is the largest bone in the upper limb? The shoulder blade. 3. What is the homologue of the radius? The tibia. 4. Is the ulna connected to the wrist? No, the ulna is not connected to the wrist. 5. What is the role of the ulna in the movement of the hand? The ulna has no role in the movement of the hand. 6. What forms the elbow joint? The ulna and the humerus. 7. What does masseter mean? Masseter means chewing. 8. What is the longest part of a long bone? The diaphysis. 9. What is contained in the carpal canal? Nerves and tendons. 10. What is a foramen? A foramen is a hole in the bone. 11. What are the largest vertebrae? The lumbar is the largest vertebrae. Part 13. 1. What are blasts? Blast means to form. 2. What are clasts? Clast means to break. 3. Are osteoblasts bone cells? Yes, osteoblasts are bone cells. 4. Are osteoblasts special types of white blood cells? Yes, osteoblasts are special types of white blood cells. 5. Does strength increase bone mass? Yes, strength increases bone mass. 6. Which hormone is associated with bone resorption? Calcitonin. 7. Can compact bones be stressed from multiple directions? No, compact bones cannot be stressed from multiple directions. 8. What is the most abundant ion in the body? Calcium. 9. How many % of calcium is in the skeleton? About 99%. 10. Do all cells in the body use calcium? Yes, all cells in the body use calcium. 11. What is the free calcium? Free calcium is the 1% of calcium that binds to proteins in the blood. 12. What form of calcium affects the body's normal function? The free calcium in the blood. 13. What is the bone cell that releases calcium in the blood? Osteoclast. 14. Where are the synovial joints? Synovial joints are near the extremities of the bones. 15. Are ligaments strong? Yes, ligaments are strong. Part 14. 1. Are tendons parts of the joint? No, tendons are not parts of the joint. 2. What limits the movement of joints? Tendons limit the movement of joints. 3. What covers all synovial joints? An articular capsule. 4. A flat bone is vascularized by? A periosteal artery. 5. Can the reference anatomical position be done on a standing subject? Yes, the reference anatomical position can be done on a standing subject. 6. The lower limb includes how many regions? 12 regions. 7. The upper limb includes how many regions? 11 regions. 8. Do long bones have nerves? Yes, long bones have nerves. 9. Do cartilaginous joints have articular cavities? No, cartilaginous joints do not have articular cavities. 10. What is the function of the synovial membrane of the capsule? The defense of the joint against germs. 11. Is the obturator foramen larger in a man than in a woman? The obturator foramen is larger in a woman than in a man. 12. What is the form of the foramen in a man? A triangular shape in a man. 13. What is the form of the foramen in a woman? An oval shape in a woman. Part 15. 1. The elbow joint has how many degrees of movement? The elbow joint has 2 degrees of movement. 2. Is extension possible at the elbow? Normally no. 3. The wrist joint has how many degrees of movement? The wrist joint has 3 degrees of movements. 4. Compare the size of the spine of a man and a woman. Normally, the spine is longer in a man than in a woman. 5. Is the axis of the body defined on a sitting subject? No, the axis of the body is not defined on a sitting subject. 6. The head is divided into how many main regions? The head is divided into 2 large regions. 7. The skull has how many regions? The skull has 6 regions. 8. The face has how many regions? The face has 13 regions. 9. Cartilage is what kind of tissue? Cartilage is a connective tissue. 10. What is the function of the cartilage? The cartilage protects the joint surfaces and certain organs. 11. Can double bones exist? Yes, double bones can exist. 12. In what situation does restorative osteogenesis occur? After a fracture. Part 16. 1. Does the sphenoid bone articulate with all the bones of the skull? Yes, the sphenoid bone articulates with all the bones of the skull. 2. Where are the ossicles? The ossicles are in the temporal bone. 3. The periosteum gives insertion to the. The periosteum gives insertion to the muscles. 4. What is the function of spongy bones? The spongy bones allow the even distribution of the forces in the bone. 5. What cartilage forms the nose? The hyaline cartilage forms the nose. 6. What is the function of the joint capsule? Joint protection. 7. How many types of synovial joints exist? There are 7 types of synovial joints. 8. Is the synovial fluid incoagulable? Yes, the synovial fluid is incoagulable. 9. Can a tendon ossify? Yes, a tendon can ossify. 10. Is the sphenoid bone part of the face? No, the sphenoid bone is not part of the face. 11. The ethmoid is part of which bone? The ethmoid is part of the bone of the skull. 12. Is the ethmoid bone involved in the formation of orbits? Yes, the ethmoid bone is involved in the formation of orbits. 13. Is the ethmoid bone involved in the formation of the nasal cavities? Yes, the ethmoid bone is involved in the formation of the nasal cavities. 14. What is the length of the spine? The length of the spine is 60 to 70 centimeters. Part 17. 1. What is spondylitis? Spondylitis is the inflammation of the vertebrae. 2. What is the name of bone infections? Osteomyelitis. 3. What is radiculitis? Radiculitis is the inflammation of the spinal and cranial nerves. 4. What is the name of the first cervical vertebrae? The atlas. 5. What are the three parts of the skeleton? The head, the trunk and the limbs. 6. What is the percentage of water in the bones? About 23%. 7. What are some functions of long bones? Movement, the support of the body weight, and absorption of shocks. 8. Are the vertebrae flat bones? No, the vertebrae are not flat bones. 9. What is unique to a compact bone? The osteons are unique to a compact bone. 10. Name a single bone among the facial bones and why is it unique? The vomer, because it is an unpaired bone. 11. What is the function of fontanelles? Fontanelles allow the development of the cranial box. 12. What articulates with the fibula? The tibia. 13. What is an important cause of osteoarthritis? The degeneration of the articular cartilage. Part 18. 1. What is unique about synovial joints compared to other types of joints? Synovial joints have articular cavities. 2. Name the two supporting tissues of the skeleton. Bones and cartilages. 3. What causes the release of calcium from the bones? Parathormone. 4. What part of the bone is inorganic? The bone matrix. 5. What is a sinus? A sinus is a cavity in the bone that contains mucus and filled with air. 6. What are the functions of the sinuses in the skull? The sinuses lighten the head and increase the resonance of the voice. 7. Why are cartilages never thick structures? Cartilages are never thick structures so that they can allow the diffusion of nutrients. 8. What permits the elasticity of the cartilage? Its water concentration. 9. What is osteogenic sarcoma? Osteogenic sarcoma is a type of bone cancer. 10. What is osteoarthritis? Osteoarthritis is bone pain. 11. What is osteomyelitis? Osteomyelitis is bone inflammation. 12. How is osteomyelitis caused? Osteomyelitis is caused by bacterial infection. 13. What is the most common cause of osteomalacia? Vitamin D deficiency. 14. Long bone growth continues until the end of adolescence. Part 19. 1. What is osteoporosis? Osteoporosis is when there is more bone resorption than the deposit, which weakens the bones. 2. When does osteoporosis begin in women? Osteoporosis begins in women after menopause. 3. What is released when the blood calcium concentration decreases? Parathormone. 4. What is the structural unit of compact bone? The osteon. 5. Name 5 types of bone cells. Osteocytes, osteoblasts, osteoclasts, osteogenic and bordering cells. 6. What presents the growth of cartilage? A fibrous perichondrium. 7. All the bones of the head are connected by sutures, with the exception of the temporomandibular joint. 8. Name the paranasal of the face. The ethmoid bone, the frontal bone, the sphenoid bone and the maxilla. 9. What is the function of the intervertebral discs? Protection against wear and friction and shock absorption. 10. What are the 3 bones of the sternum? The sternal manubrium, the sternum body and the exiphoid process. 11. What is the only bone in the arm? The humerus. 12. What is the only bone in the thigh? The femur. Part 20. 1. What are the three plantar arches? The three plantar arches are the lateral, transverse, and medial. 2. How is the spine at birth? The spine is arched at birth. 3. Who is a chiropractor? A chiropractor is a specialist in the manipulation of the spine. 4. Who is an orthopedic surgeon? An orthopedic surgeon is a doctor specializing in bones and joints. 5. Among the vertebrae, how many are mobile? 24 are mobile. 6. Is a cartilaginous joint mobile, semi-mobile, or immobile? A cartilaginous joint is semi-mobile. 7. What are the symptoms of arthritis? The symptoms of arthritis are swelling, stiffness, and pain. 8. What is the most mobile joint of the whole body? The shoulder joint. 9. Are the ligaments vascularized? Yes, the ligaments are vascularized but very little. 10. What is arthrology? Arthrology is the study of joints. 11. What is synovitis? Synovitis is the inflammation of the synovial membrane, often caused by infection, injury, etc. Part 21. 1. What is tendinitis? Tendinitis is an inflammation of the tendons. 2. What strengthens the thick capsule of the hip joint? The ligaments. 3. What are some angular movements? Flexion, extension, rotation, circumduction, adduction, and abduction. 4. What are some special movements? Inversion, eversion, protraction, retraction, and supination. 5. How can synovial joints be distinguished? Synovial joints can be distinguished by their type of movements. 6. What unites the bones in the cartilaginous joints? Bones are united by cartilage in the cartilaginous joints. 7. What unites the bones in the fibrous joints? Bones are united in the fibrous joints by dense connective tissues. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding the skeletal system of the human body.